Hi, this is Dr. Paul with CarInjuryCare.tv, and we're talking with Dr. Nick Venturino here in North Tampa. And it's the TV program that answers the most common questions about auto accident injuries, medical and legal and clinical. So the question we're going to talk about today is, how are auto accident injuries compensated? And so, Dr. Venturino, that's the question. If you can just kind of walk us through, somebody's in an accident, how does compensation work? Let's just walk us through it.
The typical rule of thumb is your compensation is based usually on the idea that it's 3 times your medical bills. So if you have $5,000 in medical bills, your attorney will typically sue for about $15,000, which pays your medical bills, pays their fee, and then puts the remaining third in your pocket. So it's not a perfect science, but ballpark, that's the goal.
Okay. Let's go a little more into detail. Let's go into some of the finer components on whether there's limitations with the individual that will increase their compensation.
Well, there's obviously key factors that increase the value of somebody's case exponentially. Number one, you've got to breach the idea that there has been permanent damage. So you have to have a physician that knows how to document and articulate that there has been permanent damage. Once you've accomplished that, then it's just a matter of how much damage has been done and how that's measured so it can be replicated and proven. And then, depending upon the level of damage you have, then the dollar amounts go up from there. Mm-hmm. So if you have a mild injury, it may be worth a small amount of money, and obviously if you have 10 times that level of damage, you're going to be looking at a much larger potential settlement.
And let's if you could let us know about how does the AMA guides apply to all this, and what are the AMA guides?
Well, the American Medical Association guides to impairment rating are sort of the holy grail for how you determine how much damage or how much injury has been sustained based upon very specific criteria. So we measure range of motion, muscle testing. There's some x-ray things that we can utilize to determine how much movement, abnormal and normal, that the actual bones are going through. So there's diagnostic testings like nerve conduction velocity studies, MRIs, CAT scans. There's a number of ways of measuring how much or how little your body has been damaged, but it's also about how you put that information together so that a jury could understand it, one, so that you have less of an argument from the opposing counsel, so that it just shows that no matter who looks at these, if you look at the facts, the numbers bear out to say you have 20% impairment rating or 7% impairment rating, and based upon those numbers, you can expect a higher or lower amount of compensation.
So the guides essentially, what I'm hearing you say is the guides give numbers to these permanent injuries that you just talked about, ranges of motion and nerve tests. Is that what you're saying?
They take into consideration the number of potential tissue that can be damaged, and then depending upon how that tissue rates as far as how much damage has been done in that tissue, then it compiles neck, low back, arm, finger, or whatever has been damaged, and then it puts a specific numerical value to how much that impacts your overall impairment, your overall normal function of your body, and then that number is what's used by an attorney to determine how much money your case is valued.
And let me understand this. So there has to be a permanent injury to some of those tissues, is what I'm hearing you say, right?
Correct.
And then you have to measure it, is that what you're saying? And then you take those measurements and apply them to the guides to get a number.
Correct.
Okay. And are some of these tissues give more weight, like ranges of motion or nerve damage? Do some of them give more weight versus less weight?
Yes. I mean, obviously, if you have damage to a muscle, the muscle doesn't necessarily carry as much weight as you do to a nerve, because the nerve can affect a myriad of muscles, where just the muscle itself is small in nature as far as its impact. So different tissue carries different weight. That's why you've got to test several different things. The muscle, its strength, how much movement it has, is that movement normal or abnormal? So there's a multitude of ways to test these different tissues so that you get the full impact of how much damage has been done.
So you accumulate all this through your examination process, I take it, right?
Examination and diagnostics.
Okay. And then you interpret it and give this AMA impairment guide rating. You do that, right?
Correct.
Okay. And then after you come up with that number, what do you do with it?
Well, we put it into a narrative report that documents how we came up with the number. We cite the pages, the graphs, so that any person that knows how to read the AMA guides can verify that what we did was done correctly and is accurate to that patient. We put that into a report, and we send that report to an attorney, to that patient's attorney, and then that attorney uses that specific information to determine how much they believe that the case could settle for.
Mm-hmm.
And then that starts that whole process.
And because it's all documented, it sounds like it's not something that you can fudge, so to speak. Make up.
You certainly cannot. If you were able to just throw some numbers out, but you couldn't substantiate them, you're going to look like a fool. The doctor would.
Right.
So it is something that you need to make sure your doctor understands how to use the guides and what specific information is involved in that, so that you do get an accurate and true assessment of how much damage or impairment has taken place. Because otherwise, I mean, your case won't be valued at much if you have another doctor that can break it all apart.
Right. And so it sounds like you need to have a doctor who understands the AMA guides and knows how to use them in injuries.
Absolutely.
So if you're in an accident, if somebody's in an accident and they're going to a doctor that doesn't know anything about the AMA guides or use them, their chance for a higher compensation, it sounds like, is dramatically decreased. Is that right?
Absolutely.
Okay. Well, that's interesting. So the attorney takes the number, and then I take it he puts it into some kind of formula or something?
It's my understanding, I'm not an attorney, but having spoken to several of them in detail about how they come up with these numbers, there's a lot of research that goes into it. They will look at your age, the county that the accident took place, because that's where it's got to be litigated. And then they look at, say, the judges. Are the judges over the last 6 or 8 months likely to give higher settlements or lower settlements for your specific injury? So say it's a herniated disc in the neck, they will look at a trend over a 6-8 month period in this particular county by that judge and say, well, that judge is typically paying pretty well for this if things are documented properly. This judge over here doesn't pay as well. So when they get in front, you know, they can sort of build their case. If they get in front of this judge, they're much more confident that they'll get paid more because that judge has been more lenient over that 6 to 8 month period versus this judge.
And you said their age was a factor, so I would assume that their injury relative to what they do for their occupation, would that be a factor?
How much time they could expect to have to live with this impairment. The older you are, the shorter period you have to live with it, but also how it affects your job. So if you're a 20-year-old baseball pitcher and you hurt your neck and shoulder, that's going to be more valuable than if you're a secretary that types, because the potential for somebody to make millions of dollars as a baseball pitcher and has a much shorter career, much greater than somebody who's making a lower salary and can do that even with some damage.
I see, that makes sense. So you have the ability, you can do this, right? You can document injuries.
Yes.
According to the AMA guides, is that right?
Yes.
And then you can give impairment ratings, is that
Correct.
right? And then, I take it, if somebody's in an accident, do you have attorneys that you work with that know how to use impairment ratings?
Absolutely.
Okay, so if somebody's in an auto accident, you can essentially put this together for them, create this, what's called the impairment rating relative to how well they're healing,
Correct.
and document it and give it to the attorney.
Correct. And that's
Okay.
important to know, because some attorneys may not use the impairment ratings or not know how to use them properly, and then you've got a whole nother issue.
Right, okay, good. All right, well, that was informative. That was good. This is, again, Dr. Paul with Car Injury Care TV.